Good morning, everyone. It's 8 o'clock. We'll give just a few more minutes to allow people to join, and we'll get started shortly, just a few minutes. All right, we'll give one more minute and we'll get started. Okay, we'll get started. Good morning. I'm glad you took time out of your day to join us. We will certainly be respectful of your time, but we also love this time of year where we have an opportunity to share with our local and state officials and national officials of the great work that this organization is able to do through the support of their efforts. And we certainly appreciate it. I am Shelley Spires. I'm the CEO for Albany Area Primary Health Care. Been around for a little bit. This is my 23rd year at this organization, and certainly have enjoyed every year. I was sharing with someone the other day, even on the bad days, I still love what I do. And that's a good job when you still enjoy what you do every day, even on those bad days. Very excited to bring to you a presentation today. We have a panelist that we will incorporate into this presentation, which is something new, and I'm very excited to have them. And we'll introduce them as we go throughout the presentation. But we'll get started. So welcome to our Legislative State of the Union. This is National Community Health Center Week, this is the period and the time that we always take to share with you the things that we're doing in the trenches, on the grounds, in the areas that you have a commitment to or a shared interest in. And this is kind of our kickoff. Yesterday we had some events, and then today we'll certainly have this event with some other events scheduled throughout the rest of the week for both the staff and the patients, just to again show our appreciation. So the theme for this year is Powering Communities Through Caring Connection. Quite interestingly, follows nicely along with our values, and you'll learn more about those as we go through the presentation. Community health centers. So some people know us as community health centers. Some people know us as federally qualified health centers. My predecessor was not a fan of FQHC term. He really liked community health centers because that's what we do. We integrate ourselves into communities and we try to provide solutions to their needs around healthcare. And so we're very excited to call ourselves a community health center. The nation's community health centers, just for some brief background, there's about 1,400 across the United States. We serve 31.5 million patients is what's written here. Hot off the press yesterday, that number was increased to 32.5 million patients with a 1 million increase. So sometimes I think that because maybe there's not enough information out there about what all we do. Some people think we're just a small mom pop shop, but we are really a piece of a bigger pie when serving the communities across the nation. And I'm very excited about doing that. Again, through your support and all that you do for us, we're able to increase access to crucial primary care by reducing barriers, making it affordable for our patients and the community members, your constituents, and just making sure that they are able to get to the services that they need when they need them. So we are very excited about being able to do that. And again, just really want to highlight the ability to do that through your support. So again, thank you to everyone that's on here. Thank you to our elected officials from all sorts. And we're able to do some of this stuff and do good work in the communities that you also support. Just a little bit about the state of Georgia and show you where some of our community health centers are located. You can see just on the little red dots, we're filling in some of the state's areas, and so we try to go to places that we can identify a need and certainly create an opportunity to address those deficiencies in those areas for the community members. We provide quality health care to the community health centers as a whole for the state of Georgia, provide quality health care to over 662,000 patients, primarily to low income, uninsured Medicaid patients. 30% of those patients are uninsured and 6% of them are covered by Medicaid. And there's other patients that actually fit in our population mix as well. So, but again, you can tell just from the numbers that our focus is really trying to provide care to those who otherwise would not get it. We contribute more than $350 million per year to Georgia's economy through indirect and induced economic activity income and 3,900 Georgia jobs. And we, again, as Albany Area Primary Health Care, are just a little small piece of that with approximately 400 employees in Albany and our surrounding areas. AAPHC is one of those community health centers that you saw on the map. As we move forward, we'll take a look at just a little bit of history again. We opened in 1979. We're very fortunate to be able to say the provider that started us back in 1979 is still with us today, the wonderful Jim Hotz. And that's something that's pretty much unheard of. So we feel like that sets us apart from a lot of organizations, not just community health centers, but organizations. With more than 90 healthcare providers, AAPHC remains one of the largest community health centers in the state of Georgia and one of the largest medical groups in the region of Southwest Georgia. So again, just very excited to be able to share that with you again through just, your support really allows us to do some of that. And I'll continue to say that as we go throughout. And again, just our partners as well. I mean, we certainly couldn't do it if we were operating in a silo, and we have really good partnerships. Expanded patient care services include those listed there for you. So my vision as CEO was to be able to provide care, provide services to those patients that otherwise, again, could not get those services. And so I reflected back on that vision. I was telling someone one day, I said, I don't think that I'll ever see it happen, but my goal is to be able to bring those services to our patients. And then as I was reviewing our service line one day, I was like, wait a minute, we're starting to do this now. So I am seeing some of the fruits of everyone's efforts, and it's very exciting to be able to bring some of the ones that we've had in years past: pediatrics, adolescent medicine, family medicine, internal medicine, geriatrics, but OBGYN, infectious disease, including our HIV/AIDS, dentistry. We have a mobile unit, which you'll learn more about, behavioral health, podiatry. Who would have ever thought we would, be able to integrate podiatry into our organization? So, very excited about, diabetes education, weight management, hormone replacement therapy. Speaking outside the box, aesthetics and wellness. Interestingly enough, that's one of those wants that the community certainly, looks to see. Do you have that service line? Optometry, huge. We were talking. I was talking with a little optometry student, I say little, but optometry student the other day, and just really emphasizing the need of optometry, just not in our area, but across the U.S. Substance use counseling, and then of course telemedicine. And again, just highlighting the fact that we have highly skilled providers, actually providing these services across 13 counties of Southwest Georgia. And we, regardless of the ability to pay. So we deliver high quality healthcare to everyone. This is one of those places that you can't go by. You get what you pay for. That does not exist here, because you get the same thing regardless of what your ability to pay is. All right, so we talked a little bit about the theme this year for community health centers, and I mentioned that it would align nicely with our core values. And so, just to share a little bit about our core values with you, we certainly we try and we strive to provide compassionate care, continuous improvement, and community connection. We call these the 3 C's of AAPHC. So we certainly try to embed these in new hires, current employees, and then certainly pass it on to our patients and the communities that we serve. As we talk about compassionate care, I just love this little girl with her cute little dimples. But as we talk about compassionate care, one of our priorities is providing it to our patients across Southwest Georgia. And I can certainly say that our providers really do demonstrate this from the highest of their ability. And always very proud to have them on my team. I have a really good relationship with our providers and certainly appreciate that. The providers and clinicians and staff, they are committed to this core value. They want to make sure that our community members also feel that compassionate care when they come to see us, and that, we still remain that safe space for their medical care. And we're certainly, we certainly thrive on that. With that being said, I'm going to introduce our first panelist. Miss Phyllis Colvin has a bachelor's in social work, but currently serves as our regional director. You will see her smiling face at Lee Health Center amongst our remote site in Vienna, Georgia, at our S. Trussell Health Center. Miss Phyllis will be walking around the waiting room. She's always trying to assist the patients with things that they need. I've witnessed her assisting patients completing forms due to literacy issues or answering questions, just really a patient advocate. And I'm very proud to have her on my team. So we welcome Miss Phyllis. Ms. Phyllis, I'd like to ask you a question about our compassionate care. And I was wondering if you would mind sharing how compassionate care makes a difference at Lee Health Center based on what you are seeing and witnessing throughout your clinic.
Good morning, and thank you, Ms. Shelley. Here at Lee Health Center, and of course at Albany Area Primary Health Care, providing compassionate care is very natural for some of us. really all of us. Like the previous slide, Dr. Babka, our pediatric physician here, just being her authentic self, the little girl wanted to come in dressed like who she admired, her physician. Um, and that was a very special thing to me to see her do that. I took the picture and submitted it to Brandy, our marketing director. And I thought about, those lasting impressions that Dr. Babka has made on her so young, that one day she may become a physician herself. Here at Lee Health Center, also Janie Dennis, who is a very busy provider here. She always takes the time when she's visiting, when she has her patients in the room, she takes the time to make them feel like they're the only one on her schedule that day. And she listens to them during their appointments and provides them clear and sound medical advice, and offers other services that are offered here at Lee Health Center, which is a multidisciplinary office. The services that we have here are the behavioral health, the med management, vision, dental, podiatry, um, and of course, our medical services here. So she tries to make sure that the patients that she's seeing have the ability to um, receive all the services all under one roof. Not only when it comes to providing compassionate care with the people that work here, there's been a time before when I had a family member who had car trouble after a doctor's appointment here. And one of our maintenance employees was here with doing some jobs for us. And when I talked to him, he didn't hesitate to assist that elderly family member with their car so they could, again, get out of that hot heat and get on home. So we just jump in and provide those services very easily. Um, One thing I was able to witness a few weeks ago with my RN clinical manager, we are very vested here in Lee County, and we were out to lunch, and there was a small child, a baby, who fell out of a high chair. And my RN clinical manager, she didn't hesitate to go help that mother and her child. She assessed the child and encouraged the mother to get her to a doctor's office to make sure she was okay. And after doing that, the owner of that restaurant came over and thanked her for being willing to assist in that time of need. Lastly, I will leave you with this. At Albany Area Primary Healthcare, when you have like-minded people working together with the same common goal of taking care of our patients and our communities we serve, providing compassionate care, it is very easy to do. Thank you for the opportunity.
Thank you, Miss Phyllis. Appreciate you sharing those stories. And that's just one of many to come. So stay tuned as we continue on. Um, Continuous improvement. We want to be able to stand behind the fact that we provide quality health care for everyone. And the way that we're able to do that is always looking and striving to be our best. We take those opportunities to improve where needed. And so we're committed to continuous improvement to ensure high quality and exceptional care to our patients. All team members are focused on quality improvement across all offices and departments. Our QI committee ensures that AAPHC family meets, and more importantly, that we exceed all of our quality goals. And we really take pride in this piece as well. We work to determine we look at our deficiencies and then we determine ways to improve those deficiencies. And across the organization, our managers, regional directors really try to figure out creative ways sometimes because our resources are just not readily available to make these things happen. And we certainly appreciate that. With that, I would like to introduce our next panelist, Ms. Sonia Miller. She is our regional director. She is stationed at East Albany Medical Center, but Ms. Sonia has been on the road traveling, just as Miss Phyllis has been. So she heads out to South Albany occasionally, and she heads out to Edison, to our Edison Medical Center, and provides guidance there as far as making sure the operations are running like they should and to make sure that the patients are receiving what they need. So we would like to welcome Miss Sonia. Miss Sonia,
Good.
oh, sorry, we appreciate
Oh,
you joining us this morning. Well, I'll let you say a few words, but I'd also like for you to answer a question for me as you do that. How does your office's approach continuous improvement? You seem to be able to have a good grip on that.
Thank you so much, Ellie. And again, I do apologize for interrupting you, but good morning. I'm so excited to speak on something that I am very, very passionate about, and that is creativity and implementation. So to be asked to share on continuous improvement really, it just warms my heart to really share that and just to share the experiences that we had. So thank you so much. So I wanted to just start by saying continuous improvement really starts with a thought. And it's a thought that everyone has to have on a daily basis, a weekly basis, a monthly basis, yearly basis. And so what we've done at our clinics is think about where we were last year and what we can accomplish this year. What can we exceed the expectations of what we are looking to do? And so how can we evolve? So this is something that we've always done. So I wanted to start with this quote that I wrote down that I pretty much pattern myself with. Excellent is not a destination. It's a continuous journey that never ends. And so that journey that never ends, that's continuous improvement. And that can only be accomplished when the team understands that process. So this is the first step that I did. I'm going to give you 3 things that we've done at the clinics to make sure that continuous improvement is ongoing and that we provide excellence and, as you've all stated, quality care for our patients, because our patients are looking for us to do the above and beyond. And if we're going to provide quality, it definitely starts with our improvement on everything we have. So our continuous improvement, first thing that we've done was evaluate the team. Number one, first of all, you have to come in and decide where are the strengths, who's strong in this area, what do we need to do? We have the goals, we have the initiatives, we have things that we need to do. What do we need to do? So we evaluate the team, raise the value of the product that we are giving to our patients. The product is us. I am the product. The team is the product. What do we want the patients to see? What do we want them to experience? So the product has to be raised, number one, and that takes time. So I'm not going to go all the way into detail of that, but that is a major part. First of all, incorporating the team. What do we want the consumer or the patient to see? How do we want to serve them? What's the culture? How effective is our product? What do they portray when they see us? This team evaluation must begin with everyone doing a self-evaluation in the clinic. And so that's what we did first. We started doing that. So how I did that was begin to speak life to the community that was on the inside and say, okay, I can't just go and say, these are the things we need to start doing. You're not working on this. You're not doing this. You're not improving here. But I need to empower you to understand I need you, first of all, to improve what we need to improve. You're here, so we need your input. So we need to speak life. And then some of the things that we did, we started initiating visual boards, because most people are visual. They like to see their accomplishments. They like to see where we're going. They like to see where you want to take me and where we're going. So that was the one thing that we did. So to improve the team, we had to improve ourselves first. And that approach was one thing that we implemented was called calculating the cost. Calculating the cost. So you have to decide once you walk into the door, you are the product. Are you adding? Are you doing addition? What are you adding to this? What are you subtracting? What are you multiplying? And what are you dividing? So you have to decide, first of all, where am I today? This is why the continuous improvement is every day. Where am I? Am I adding to this vision? Am I subtracting with my attitude? Am I multiplying? That means we're progressing. Or am I dividing? Am I divisive? So those things were very key to implement. Number one, to incorporate the team, evaluate the team, which is the product. That's going to be very key. The second thing was creating a plan of action and executing the change. Things that we've done from the front office all the way to the back office. Everyone has to buy in to continuous improvement. Like I said earlier, it's an everyday process. Getting everyone to buy in, plug into whatever your department goals are, whatever your expectations are, bring that to the table, and we can all do this together as a team. We did events. We empowered the team. We keep them motivated. If the slide before, you saw the thermometer. So we did that with our referral specialists, make them feel like they were a part of the team. What is your goal? What did Dr. Yates give you as a goal for quality for your referrals? So if your temperature needs to go down, then on the other side, we did a temperature that needs to go up. And that was the KPIs. So we did a whole competition. That's a whole nother level of empowerment, whole nother level of bringing the team a part of to creating the continuous improvement that we were looking for, and which also unifies us in growth. And the last thing that we did was measure your results. Weekly audits. Where are we? What did we do? Have we accomplished our goals? Meet weekly. Create an inside team that is leadership, your core leadership team that will help implement continuous growth in the organization. Set goals, discuss our successes, our failures. What are our strengths? What are the strengths? What are some of the weaknesses? Encourage, continue to empower, and just repeat over and over. And so having the attitude that it is always going to be a to be continued. You can't stop. You can't park. Yes, you may have some good successes. You may meet the goals, but how can you exceed the goals? So continuous improvement is all wrapped up into quality care. In order for us to give the quality care, we have to continually improve. And this is what we've done at the clinic. So I leave you with the last quote that I have. Coming together is the beginning. Keeping together is progress. Working together is success. And this is how you continue to improve within an organization and improve as a person, continuously improving together. Thank you, Shelley. I appreciate the opportunity as well.
Thank you, Miss Sonia. Appreciate that. Very powerful statement around our quality improvement. And certainly we appreciate that. Something we get pretty excited about. This is something that always boosts morale. We talk about it every legislative breakfast that we have, but this is what brings us up when we might be down. We get excited about some of the community events that we do. We have a really good time doing it. As you can tell, it's a time that we can all come together and have fun and really give back. So supporting our communities by serving, volunteering, organizing healthcare events, it's one of our major priorities for our organization. We always like to see the communities come together. The community health fair that we have every year, it's the first Saturday in October, just putting a plug in. We have a lot of partnerships. And again, I mentioned earlier, we can't function in a silo. I'm one that likes to see the needle move, and I know in order to move that needle, I can't do it by myself. And so we bring our partners together throughout the year, but we bring a lot of partners together at this health fair. Our providers, clinicians, and staff are proud to live and work and serve in the areas across Southwest Georgia. And I think you'll see a little bit of it as I show this video on our next slide.
AAPHC hosted its 10th annual Community Health Fair on October 7th, 2023. This was the 4th year doing the drive-through model. Total screenings completed during the 2023 Community Health Fair was 108. 122 blood pressure screenings, 100 glucose screenings, Dougherty County Health Department provided 80 people with flu shots.
We want help! Man, that's right, man. We right here, man. Just a ride along.
38 free HIV screens were completed and all were negative. 68 vision screenings. CareSource, Senior Resource Center of Georgia, AmeriGroup, Horizons Community Solutions, Diagnostic Imaging, Georgia Stars, Tift Head Start, United Healthcare, and Albany Police Department, just to name a few. AAPHC also received resources and support from several pharmaceutical companies and local sponsors. Adams Exterminators donated $250 this year towards the health fair, and Huey and Newman donated $100.
So as you can tell, we take great pride in trying to make sure our community is seen about. So we, as we do this, you might have noticed that in there were some baskets in cellophane. So I'll have Joycelyn, I'll introduce her in just a second, but just this is like her baby. She's actually taken this on, and as you can tell too, the cars and where they go has to be quite organized. And so I think logistically that might be her strength, is making sure that everybody knows where to go. But back to the baskets, we also do a competition throughout the clinics on who can create the best basket. And then Joycelyn presents them with a prize and highlights them and showcases them as the basket winners. With that, I'd like to take the opportunity to introduce Ms. Joycelyn Yates, our Chief Quality Officer. Joycelyn, I'm going to turn it over to you, but before I do, it's no surprise that community connection is important to you and all of us. Could you share how annual health fair plays a part into this, how this really works toward it?
Yes, and thank you so much, Shelley, and good morning, everyone. I just want to briefly state that connection to the community refers to a feeling of belonging. It means being a part of a community that shares common interests, values, and experiences. When you feel connected to something larger than ourselves, it leads to a sense of belonging and commitment, and that's exactly what the community health fair means to me. Having the community outreach health fair helps our community reduce chronic risk and chronic diseases in our community by providing health screenings to our community that they may not receive. And we do this free to our community. We help people feel safe and secure, and they can realize that they're not alone and they can depend on us to help them. It also means it's a sense of belonging. When you feel like you're a part of something bigger than yourself, you understand as an individual that you are doing something for a greater good. Lastly, community connection helps in our overall learning. Community connection can especially be important for not only the community, but also our employees through their volunteerism, where they learn about diversity, equity, and inclusion. AAPHC is proud and we stand boldly because we foster innovation and we attract diverse talent that serves in our community. And lastly, I want to leave you because I think the video speaks for itself. Community is much more than belonging to something. It's about doing something together that makes belonging matter. And that's what that stands for, Shelley and everyone. Thank you.
Thank you, Joycelyn. Appreciate that. And again, it's a lot of fun. We have a good time while we're providing those services to the community. We as the volunteers get something back, and it's actually some fellowship. that sometimes we lose sight of when we're in the trenches in the daily work. We get a chance to really have a good time. So, all right, moving right along, just to share a little bit also about our mobile units. This is our big blue bus. As you can see, we keep our bus on the road. It's constantly, you may see it in a church parking lot. You may see it in a school parking lot. It's constantly on the go, and we're very proud of it. Our mobile units are equipped for all of our services, and so we have the opportunity to take it and serve our communities based on those service lines that we provide. We have 2 mobile units to provide primary care and specialty care. So we bring the exam rooms out of the doctor's office and we put them right there in our community members' lives. Whether that's at their home, their church, community events, we're always offering health screenings and vaccinations. We're very proud of our mobile units, very excited to have them. With that, I'll move to introducing, I think we could almost label her as our mobile unit queen. When you see the mobile unit, you see BB Hale. She is our patient navigator, our school-based health centers and mobile access care unit driver. Really, she's again, she's the face in the front of the mobile unit as well as our school-based health centers. BB is one of those who continues to give back and always smiling. So we certainly appreciate that. BB, good morning.
Good morning, Shelley. Good morning, everyone.
Our mobile units and school-based health centers are so critical to our communities. What feedback do you hear from parents in the community about taking our mobile units out and our school-based health centers and all the good work that we're doing in those environments?
Some words come to mind, which is quality care, success, well-being, thrive, and hope. With that said, in my words, the core of our work is not only helping students, families, communities, and our school system achieve their very best. We are devoted to providing the highest quality of healthcare. Our school-based healthcare centers assure students access to healthcare and support systems to help them thrive. Our mobile unit team and services are focused on the well-being of our students and their families. In the past year, we have taken our mobile unit to schools in our rural areas to ensure they receive the same exceptional care. We support our school mission of student success and encouraging the community of hope.
Thank you, BB. And again, this is one of those, I guess, initiatives that I really like to highlight, because if our kids can't see, if our kids aren't healthy, if they're always sick, they're not in school. If they can't see, they can't read. If they can't read, they can't graduate. And so very excited to be a part of this and the fact that we can continue spreading that initiative to more schools and other schools. So thank you, BB.
Thank you.
And if y'all see the blue bus, just wave. That's BB. And so again, thanks. As we move along, we'll talk a little bit about our pharmacy. And then I'll introduce, and then she'll actually present herself right here on the video, but we'll introduce Miss Ashley to give us more details.
AAPHC Pharmacy is unique in many ways. First off, we're one of the only organizations that have a pharmacy located in 2 of our doctor's offices, and this really increases efficiency for our patients and convenience. When our patients see the doctor, they can come directly to the pharmacy, walk right over, get their prescriptions filled. A lot of our patients have really busy lives, so they find it difficult to come to the doctor, then drive to the pharmacy, wait for their prescriptions to be filled. In this way, we're able to eliminate that step. We also have a very open line of communication between our providers, so if there are any medication concerns or issues, we're able to quickly resolve them a lot more faster than the other pharmacies. We also offer free home delivery and delivery to AAPHC clinics. So our pharmacy is totally dedicated to AAPHC patients.
With that, I'll add we have a really good team of pharmacy staff, and we have 2 locations now, and I'm sure Ashley will talk about those, East Albany and Lee Health Center. You know, it is nice. Again, one of the visions is to be able to eliminate barriers to care for our patients, and that's really kind of our strategy when we are planning for the future. How do we do that? How do we eliminate? What are those barriers, and how do we eliminate them? With that being said, I'll let someone with more experience talk medicine and drugs. Introducing Ashley Eshman, who is the lead pharmacist at East Albany Medical Center. Thank you, Ashley, for joining us. Not every CHC can offer a pharmacy to its patients. Why is having our own pharmacists or our pharmacies such a positive and asset for our patients?
Well, good morning, everybody. I agree with Shelley. We have such an excellent pharmacy team at both East Albany and Lee Health Center. I think that it's an asset to our organization, not only for patient convenience, but safety. Our patients are our family, and they're in our community, and we're able to close the loop when the patients come to the doctor. If the patients come to the doctor and they're prescribed medicine, a lot of times when they have to go to an outside pharmacy, they don't get their medicines, or their medicines are too expensive. And what benefit did we really have on the patient if they can't get the medication that they need? So we're able to close that loop, make sure the patients get the medications they need. A lot of times we have patients that will call and say, hey, I need you to refill everything. I've worked in an outside pharmacy that's not associated with an organization, and you're kind of blind. You just, fill everything the patient has refills on. With the patients using our pharmacy, we have access to the electronic medical records. So we're able to, go into their charts and make sure that they're getting the right medication, that they're not getting ones that have been discontinued, or getting old medications where the dosages were changed. We're able to make sure that they're getting exactly what the provider wants them to have. And, I have a motto with the pharmacy that I've worked really hard to instill, is that treat every patient like it's your mom or your dad. Would you want, your mom how would you want them to be treated? And that's the way that we treat our patients, because they are our family. And so, a lot of people also can't afford medications. Some of them are expensive. We have lots of programs to help patients with that. And if patients can't afford the medications, we're able to contact their providers really fast and get those problems resolved, and make sure that they stay compliant to their medications. The pharmacy is a very important part of the members' healthcare team, and we're just so proud that we're able to provide these services for the patients so that they receive the best quality care possible.
Thank you, Ashley. And I think it's very important to highlight the impacts of 340B drugs that have allowed us to be able to provide this. And again, through your support of that program with FQHCs is huge as we continue to improve and add services. So we're very thankful and appreciative of that opportunity. When we're looking at why community health centers matter, you can always see AAPHC provides value not only to our patients, but our communities. I think we've demonstrated that by sharing some of our activities. We care for the most vulnerable in our communities. We have some complex patients. And as Dr. Hotz, as I was mentioning him earlier, one of his sayings is we're like the Marines, we go where others don't want to go. So we're always willing to take on that person, that patient, that family that wasn't able to go somewhere else. Your community health center, and it is your community health center, is a safety net for the uninsured, the underinsured, and those who often have nowhere else to go. We provide high quality care to ensure care remains accessible and affordable for all. And we're proud to serve our communities. We're proud to be in the front lines of care. And, as we reflect back to COVID, I mentioned then, and I'll continue to mention, we didn't close our doors, and our staff was right there with me. They were behind me 110%, pushing forward to make sure that our patients, our community still had access. So just very appreciative of the support that we've gotten. We're going to fast forward and look ahead and just kind of give you some ideas about what 2025 might hold, and just kind of give you a list of our priorities, and of course some of our challenges. But this is some of the things that we're, wanting to embrace in the year of 2025 and beyond. So you can kind of have an idea of what our plan is moving forward. It's no secret that we live in an OB desert in our area of Southwest Georgia. It is certainly concern, maternal health, infant morbidity, mortality. It's just it's sad, and we are continuing to strive and establish partnerships. Very thankful for Phoebe and Morehouse and some others who are coming together, and we're really just trying to strategize on how do we move the needle so that our women get the care that they need, and that those babies come out with help, they're healthy and ready to go home within a day or so, and mom's ready to go home. And then again, just the aftercare, the postpartum care, and really putting an emphasis on the importance of understanding what that feels like and how do we address that. Increase our preventive screenings. One of my co-workers' grandchild said, I wish cancer would get cancer and die. I thought that was a good way of saying it. So we're going to try to smother cancer by doing preventative screenings to ensure that we have all those cancer screenings embedded in the care of our individuals, as well as the preventative screenings around A1Cs, hypertension, and so on. So really just putting a focus on how do we keep our patients as healthy as possible. And again, through partnerships, we're able to do that. Expanding the outreach of our mobile unit. Again, we're going to stretch BB out and put her on the road and get her to more places and be able to reach more people, and really just share the word about the good work that we're doing. Expanding our school-based health center programs. There's more coming on that. We've actually had an opportunity, again, through the support of our state officials from the state level, and also from our local and national. And just, we have a really good relationship with our superintendents of the schools that we are embedded in, and we certainly appreciate that. And we continue to use that to highlight just, again, that importance of partnerships. Ensuring every resident has access to high quality care. Focusing on our providers, care teams, and staff and their well-being. Again, our people have to be well so they can take care of our patients and community. So continuously looking at ways to ensure that they have what they need. Strengthening our partnerships with our healthcare and community partners. And I've mentioned a few here today, but yes, we can't do it alone, and we'll continue to work together to bring a healthy community or an environment for our community to live in. So the availability of a HRSA loan repayment, we have an opportunity that brings professionals to our area, so that's always a positive. Especially when we're looking at nursing shortages and provider shortages. It's not just in Albany, Georgia and surrounding areas, it's nationwide. But we continue to have opportunities through our status as a federally qualified health center / community health center to bring that to our area. So truly being an asset to the community by having these perks and these potentials is certainly one of the strengths that we are able to offer. Again, I just want to thank our legislators, community leaders, advocates who continue to support our 340B program, as I mentioned. This program, again, provides affordable cost to our patients. And again, with that rising cost in prescriptions, we're seeing all patients struggle, not just ours, but family members, friends. So we're certainly thankful that we can continue to do that. And most all, we are so excited to have a positive impact on our communities. And your support, plus legislation that protects funding for these centers, will be much needed in the years ahead. So please continue to support us, continue to understand what we're doing. Reach out to me if you have a question, please do so. And again, I can't say it enough. We're just very thankful for what you do for us, and stand up for our community health centers to ensure we have the most high quality care for our communities. So one last plug as we talk about, before I have open it up for questions, we are in the process of a coat drive. Again, our school-based health centers, BB is always, she'll come to me and say, we got to have this, we got to have that. Typically what we do is we spread it throughout the organization, and before you know it, we have a lot of materials or food or toys or at Christmas time. So we thought we'd open it up to you all. For National Community Health Center Week, we're hosting a coat drive for our students across Southwest Georgia. You can drop those off at our administration office at 204 Northwest Dover. So clean your closet out. I know you're like me. You have those coats of those kiddos that don't fit anymore. Or maybe you just feel the need to give back and want to go purchase a nice little jacket for someone. We are certainly appreciative of whatever you can do, but those can be dropped off, new or gently used coats. And if you could, we would just ask they be dropped off before August the 14th so that we can get them to our kiddos at our school-based health centers. And with that, I'll take any questions, comments, concerns. I know we're approaching our time. And again, like I said, I just want to be very respectful of your time. And again, thank you for joining us. And please reach out to us if you ever have any questions, or if you just want to partner and you think we might have something to offer, certainly reach out to us and we'll be more than glad to consider. Thank you all. Appreciate it. Thank you to the panelists. We appreciate your comments, your feedback, and your stories. And we're excited about finishing out our National Community Health Center Week. And if you see us, or if you see the blue bus, just please wave. Thank y'all. Have a good day.